Mental Health Monday with Mick Coyle.
Radio City Talk.
It's Monday once again, so once again it's time for Mental Health Monday. Very pleased to say we've got a special guest in the studio who's got a paper which is out in the last few days, and she's joined us in the studio to talk through it. It's got a title which runs like this: Changes in Millennial Adolescent Mental Health and Health-Related Behaviours Over 10 Years, a Population Cohort Comparison Study. The co-author is Dr. Suzi Gage, who's been on the programme before. Dr. Suzi, great to see you. Thank you for your time.
No problem. Thanks for having me back.
You're from the University of Liverpool, but you're a co-author with another academic who's been working on the study with you.
Yes. So Pravitha Patale, who she used to be at the University of Liverpool, she's now at UCL, but because of our different sort of histories and whatnot, we both had worked with different birth cohorts. So this is groups of people who were followed up since their parents were, well, their mother was pregnant, and the mother and the child have been followed up ever since. And I worked with a cohort in Bristol when I used to live there, where the young people were born in the early 90s. And Pravitha works with a study called the Millennium Cohort Study, where the young people were born in the early 2000s.
And when we talk about evidence, and I know you're sort of big on evidence-based research, whenever we talk about young people these days, we make huge sort of leaps of faith about things that are going on, whether it's the Momo challenge and whether or not that actually exists at all, whether or not screen time is damaging, lack of sleep is damaging, whether or not they should be starting school a little bit later because that's good for them. And we always relate things to, well, when we were their age, this is what we remember, and therefore that's good enough. Your study actually has looked at what those young people experience now and then, and you've looked at different sets of stats to bring them together to get a genuine sense of really what's going on with young people.
Yeah, exactly. So because these two cohorts were born, the young people were born 10 years apart, but the questions that have been asked to them over the years are broadly very similar. So what we were able to do was, where the questions were identical, we could directly compare at the same age, so 14 in one cohort compared to age 14 in the other cohort, 10 years apart. But also where the questions were similar, we were able to sort of create measures to make them more comparable. And we also tried to match the cohorts as much as possible as well, so around things like demographics, because obviously that can have an impact on things as well. So what we're hopefully seeing isn't just differences between the two cohorts of young people, but is actually what's changed over the last 10 years.
When you started looking through the results, and we'll talk through what the report's found, and that's why you're here today on Mental Health Monday, did you have a preconception? You've done enough of these studies to not decide that, but you must have in your own mind, are kids going through a worse time, a better time? Are things changing? Are things not changing? What were your preconceptions going in?
Well, that was kind of the motivation for doing it, because we have seen loads of reports in the media over recent sort of months and years about depression being on the rise in young people and things like that. So we knew about that, but what we were less clear about, there are also reports that young people are drinking less, for example. But as far as we knew, no one had looked at all of these kind of mental health, health-related behaviours, substance use, things like sleep, things like obesity. Nobody had looked at them all in the same study. So we just thought, well, actually, we could do that with these two data sets that we have.
And in terms of what you found, can we talk about depressive symptoms first, depression?
Yeah, I think that's probably one of the most striking findings, and one that perhaps isn't surprising because it has been reported quite a bit that depression is on the rise. But we found that the number of people reporting high depressive symptoms went from 9% of young people in the earlier cohort up to 15% of young people in the more recent cohort. Which,
depending on your maths, some people go, that's a 6% increase, or that's nearly double.
Yeah.
And the nearly double is the one
it's a 6 percentage point increase. Yeah.
But that's a big increase.
Yeah.
And these are young people who were young people in 2005 versus young people who were young people in 2015.
Yeah, so this was age 14 that we were looking at for the most part.
That number is significant as well. In terms of those measurements, those came from the questions that were asked. Were they specific questions about depression and mental health?
So this is one where we didn't have to do any harmonisation of the data because exactly the same questionnaire was asked at both time points. So one of the things that some people have said to me is, oh, well, perhaps it's just that young people find it easier to kind of endorse having these symptoms at the moment compared to what it was like 10 years ago. Stigma is decreasing in terms of mental health, although, as I'm sure that your listeners are aware, it hasn't gone away. So perhaps it's just easier for people to say, or young people are more likely to feel like they have depression or sort of depressive symptoms. But this was a questionnaire, I can't remember the exact questions, but it was about 15, I think, 14 or 15 statements about a person's sort of experiences and feelings. It's called the Moods and Feelings Questionnaire, and it's quite a well-established questionnaire that's used in this age group, and it's been validated and that kind of thing. So there might be that people relate to sort of being able to say that they find it harder to take joy in things, for example, now than they did 10 years ago. But actually we were asking both groups identical questions and then creating a score based on their responses to a number of different... So it wasn't just, do you have depression? Yes, no. It was a much more detailed measure than that.
Yeah, and I think 'cause sometimes if you say, well, you're more likely to say something now because we're in more sort of open times about mental health, you could equally argue as well that the normalisation of stress in that period of time would make people go, well, I am stressed, but no more so than anyone else, therefore I wouldn't. So, but
exactly,
actually, the way that it's been derived over that 10-year period really sets it out. So that's 15% in 2015 versus, or just under 15%, I think it was, versus 9% in 2005. There's been some other things within there. People go, well, what are the reasons? Let's do social media and screen time first. 2005, social media was in its infancy and just starting out. Were there specific questions about social media and screen time? Were there any flags that you saw in regard to screen time, particularly with the 2015 cohort, that made you go, we've got a reason? We've got a smoking gun, if you like.
Because we couldn't compare directly social media use, because as you say, in 2005, it was very much in its infancy. We don't actually have a measure of that, but this is something that we're going on to do now. So our results are really interesting and they look at what's changed, but they can't tell us anything about why those things have changed. So that's something that we want to go and do now. And we're already working on our next paper, and hopefully it's going to turn into a sort of bigger programme of work to try and unpick this. And I think a lot of people's immediate reaction is social media and screens, and that's probably because of the kind of like media atmosphere that we live in at the moment, where these things are seen as a potential problem and alarming a lot of people. But a lot of other stuff has changed in the last 10 years as well.
Well, we're speaking on a day where the top story in our news is about the proliferation of knife crime, which people associate with gang culture, which people associate with antisocial behaviour. Mm-hmm. But there was a very marked change, wasn't there, in the responses in regard to whether or not young people experience antisocial behaviour in 2005 versus 2015. And it went maybe a way that people wouldn't expect.
Yeah, absolutely. We found that these types of behaviours in 14-year-olds were decreasing over the last 10 years. So quite substantially in some cases. For example, likelihood to have done graffiti or vandalism or have assaulted someone. I think that measure was kicked or punched someone. So it's not sort of assault where you might have to go and
appear before a magistrate.
Exactly. It's more just kind of violence towards your peers or towards other people, and that dropped quite substantially. So we see in the media that there are problems with gangs, and maybe it's a slightly older age group than this. So obviously we're only looking at one particular time point, and that isn't to say that this isn't a problem at the moment, but certainly in our results these antisocial behaviours had fallen for the most part.
Something that has increased, and obviously we're focusing on mental health here, but there's always a link between physical and mental health. Can I ask you about physical health? Because obesity was part of the measure as well. And again, when we hear about stats of obesity on the rise as well, there are two aspects to this one. First, there's the actual figures of number of obese young people at the age of 14 versus the perceptions around weight, which threw up different sort of responses.
Yeah. So we collect all sorts of information from these cohorts, including things like height and weight, and from that you can work out someone's BMI. So BMI cutoffs aren't brilliant, but they're very useful when you've got large groups of people to work out sort of averages. And the number of people with an obese BMI at age 14 had gone up from 4% to 7%. But the number of people who perceived themselves as overweight rather than sort of that they perceive themselves as a sort of correct weight or perceive themselves as underweight went up from 27% to 33%.
So that's 1 in 3.
Yeah,
that's again, it's a less significant rise than some of the things, but it's still a significant rise. If we throw social media into the mix, into that one, you could arguably say, well, actually, we've just come out of the era of sort of the beauty magazines and the fashion magazines. Maybe that era has come to an end as well. So there's something else maybe that's going on there that could be measured or looked at again. 1 in 3 young people looking at their bodies and going, I'm overweight. That's a tough one, that, isn't it?
Yeah, and particularly at age 14, which is still relatively young, I would say, to sort of have those kind of pressures on you already.
I know you flag up in the research, and you've done a write-up as well on cosmic shambles, where you talk about, it doesn't reveal what has changed, but you mentioned sort of like a suggestion, exam pressures. We've had austerity.
Exactly.
That's kicked in since there as well. Parental stress and the impact of that, plus social media, I mentioned as screen time as well. There needs to be, whatever the reasons are, they're going to be pretty holistic, aren't they?
Exactly.
It might be a bit of austerity mixed in with social media.
I think it's
with
very
the exam
unlikely
pressure.
that there's going to be one thing that is to blame. We can just say, right, well, it's that one thing. I think it's all these different pressures that kind of create a pressure point, as it were.
If you think you were to go back to, say, 1995, or to jump ahead now to 2025, if we were looking over a cohort at the other ends, would we be looking at trends which were going up and continuing, do you think?
Well, I mean, obviously that's a very difficult question to ask, but I think it highlights something quite important about these findings, that they are only 2 time points, and actually things do fluctuate over time, and that doesn't necessarily mean it's a sort of linear rise in one direction. It could be just sort of like random variation over time. So one of the other things we want to do is kind of extend this further back and see whether the patterns that we're seeing, although with things like depression, there are studies that have looked at it earlier, and they do find that in the 90s it was higher than it was sort of 20 years earlier, and it seems like it's not only increasing but potentially even increasing at a faster rates of depression in young people.
Age of 14 is such a crucial age as well. We know the stats around those who have an established mental health condition at that age and their likelihood to take it through to adulthood. So if that number is increasing in that mid-teen period, then that's something which you can extrapolate and extend and look at and go, well, here are problems then which are potentially foreseeable when they hit the age of 25, 35 and 45 as well. So that's when people who can make decisions can look at something like this and go, right, straight away we have a sense of what the numbers might be and where those numbers might be in a few years' time. Has anyone come forward yet to ask for those results?
Not yet, but I mean, this paper was only published a couple of days ago, as you say, and in a way this kind of finding that depression is on the rise in teenagers is not a new finding. This is kind of extending it to look at the other factors that might also be involved. But I think just like in a way it kind of, obviously it matters why, because prevention is better than cure. But since we know now that this is increasing and it is a problem, that means action can be taken to support young people who are struggling now, while researchers go back and try and work out why it is and think about steps going forward.
Yeah. Was there a particular element of the study where you thought, oh, right, I wasn't expecting to see that? Was there one set of data where you thought, oh, hang on a minute?
Well, one of the things that really surprised me is, my research interest is really looking at the links between recreational drug use and mental health. And we see in loads and loads of different studies and study designs that use of substances, particularly heavy use of substances, is strongly linked to poorer mental health. But over the last 10 years, in 14-year-olds certainly, heavy drinking has declined and ever tried smoking has declined. Other drug use was at very low levels anyway, and has kind of stayed at that very low level, sort of less than 1% of 14-year-olds in either cohort were using other substances. And cannabis use, it's gone from 5% to 4%, but it's not a statistically significant change, so it's kind of the same really. But that's kind of surprising, because if we think that substance use might be a predictor of poor mental health, but substance use is going down and poor mental health is going up in the same group of people, that suggests something else is going on.
Well, this is what I wanted to ask you about, because, of course, there is that thing where you look for a knee-jerk, which you go, right, it's blame social media, blame what's happened in the last 10 years, social media, therefore that must be the problem as well. But like your study, you could throw obesity into that mix and go, well, actually, let's look at the rise of obesity versus the rise in potential mental health problems in young people. And also sleep.
Yeah.
Or lack thereof. Now, for me personally, as a new parent, sleep is absolutely crucial. I was talking about it last week with Jake Mills from Chasing the Stigma, because sleep for me is one of those factors where if it doesn't come in, I feel it, and I feel it quite significantly when it comes to my own mental health as well. Mm-hmm. But in regard to this, the amount of late nights, early rises, that's changing as well within that cohort, 2005 to 2015. Can you run us through what's going on?
Yeah, we looked at people who were getting insufficient sleep, so that's less than the recommended 8 hours a night. And in the earlier cohort in 2005, it was about 6% of 14-year-olds, and in 2015 it was about 12%. And it was coming from both ends. They were going to sleep later and waking up earlier. But it was most striking on weeknights rather than weekends. So some people have again said, well, they're checking their phones, their phones are going off at night. But the fact that it's at weeknights and not so pronounced at weekends, to me also suggests that school pressure might be playing a role there as well. And
that's gone from 1 and a bit in every class to essentially you're getting three kids in every class who simply haven't had enough sleep the night before.
Yeah.
It's interesting, but what do you do with that? Because it's that thing where you want to legislate for something, don't you? But then you can't force young people to go to bed. You can't do. So when you look for answers there, but that's why the answers and the sort of the ramifications for this study suggest a much more holistic look at what we're doing with young people, rather than just going, well, it'll be the drugs.
Yeah, exactly.
Which is a nice, easy response to stick on the front page of a paper. It's not necessarily what the study has found. You've done a sort of a write-up of this, cosmicshambles.com.
Yep, that's
the website, which has got sort of a write-up and your take on what you've seen as well. Dr. Suzi.
Hi, yep.
Epidemiology.
Not the skin, which is what lots of people think, but it's more like the word epidemic rather than that. So it's kind of looking at population level health. So using large data sets to try and understand patterns in health, mental health, substance use, kind of you name it.
Which is exactly what we've been talking about in regard to the study that she has co-authored, and all the details of which you can find. In fact, we'll get links up on our social media at Radio City Talk under the hashtag Mental Health Monday, so you can read it up on it yourself. From your study, Dr. Suzi, when it comes to what we do next and what the next set of statistics look like, from what you've seen, is there anything that's actionable? When we talk about study, cause, effect, and then response. Yeah. Is there anything in there which, if somebody came to you, a mental health minister, somebody who works in employment, somebody who works with young people, and went, right, well, what can we do with this then? What can we do with this? If we know these facts, what action can we take that can make a difference to young people now?
Well, as I said earlier, it's difficult to tell from this what's causing what and what's causing these changes in, for example, poorer mental health. But I don't think that means that we can't take action to try and support young people, particularly around the higher rates of depressive symptoms that we're seeing in young people. I don't think this is just young people feeling more comfortable in sort of saying they've got a problem or like over pathologizing. I think this is young people who are actually struggling and could use support.
I guess as well, there's the sort of the nuance that comes from it now, whether it's a teacher or intervention from a parent or a youth leader as well. Do you get a sense that you can ask young people themselves what it is? Are they equipped from what you saw? Are they equipped enough with a response that might be useful?
Well, see, this is the thing where working with these cohorts sounds much more kind of exciting than it is, because you'd think from looking at our results that we must have spoken to some really interesting people, but because of confidentiality and all of this kind of thing, the researchers like myself, we don't get to go and do the interviews with the participants. We receive a spreadsheet of ones and zeros. So I can tell you all about the ones and zeros, but I can't tell you about the young people themselves because obviously to protect their confidentiality, the researchers don't get to interact with them. Having said that, I've given talks in schools and that kind of thing, and I think that asking young people about what kind of support that they want and what kind of problems they're having is an absolutely perfect way to start, and it should be a kind of obvious first port of call for people looking to help.
The last 3 people I asked about young people and mental health weirdly all gave me the same response. What is it about young people and mental health at the moment that is making the biggest difference in their lives? Expecting the internet, expecting social media, peer pressure, bullying, online bullying to be the official response. And 3, independently, organisations working with young people all said they feel like they don't have a stake in what's going on around them. And I thought, oh, wow, because that's not, again, when we look at, it's not online bullying, it's not illicit drug use, it's not exam pressure. It's a sense of powerlessness, almost worthlessness. They feel like they don't matter and that they don't count and they don't have the ability to affect and change things. And I thought that's actually a powerful response and almost quite an intelligent response, because they've looked around, they've seen what's going on in their lives, and they've thought, I can't do anything about this, which is a very difficult place to be for a young person. Bad enough being a teenager.
Yeah, absolutely. And I mean, I'm not I don't think that's necessarily an uncommon feeling to have as a teenager, but if it's getting more pronounced, I think that's really, really worrying. It's something obviously very difficult to pick up in kind of surveys and large-scale cohorts, but if that's what young people are reporting, I don't find it particularly surprising. I think certainly if we look to the media, the way that young people were, or the way lots of people responded to the climate strike, that young people took time off school and went and protested about climate change, and the sneering responses from older generations was embarrassing. And it's no wonder that young people feel the way you've just described, if that's kind of, they try and take a stand and they're basically told to go back to school, and while the country's kind of tearing itself apart over Brexit. You know, it's but you can kind of relate to why they feel like that.
Sea levels are rising. Literally, the air that they breathe on the way they walk to school is irreparably damaging their lungs. Toxicity absolutely everywhere. And then there was a fella on social media who went, well, if you care about the environment, you shouldn't have trodden all over that lawn.
Yeah. Lawn, that natural thing that occurs.
And that will grow back.
Yeah.
Versus the permanent damage being done to the environment. I quite like that response. But young people, as and when you want to speak out, feel free to do so. One day you will rule us all. Can I ask you about your own work now, Dr. Suzi? Fascinating job. For anyone who's followed your podcast as well, Say Why to Drugs, you do some really interesting work in a really interesting field. And I always get a sense, because I listen to the podcast, that you're still sort of operating just on the, like, you've got all this information and you're looking at all this study and it's all dead interested, and it strikes me as really, really useful. But it almost still strikes me that you're talking like in phrase which are stigmatized if you drag them into the mainstream, particularly when you talk about drug use, when you talk about the legislation around drug use as well. Do you get a sense of that, or do you feel like you're still a little bit of a renegade when you're talking about these sort of subjects?
I don't know about renegade, but certainly I guess I'm trying to present things in a really dispassionate and evidence-based way, and not to go beyond what the evidence says. So lots of the podcast is filled with caveats and but we're not sure, and kind of more research is needed, that kind of thing. And I feel like I'm constantly saying, it's really hard to tell this because the research isn't there. But that's kind of an accurate representation. In terms of stigma, I think there's still loads of stigma around drug use. And actually, I'm involved in a project at the moment with colleagues at John Moores investigating the potential impact of stigma and thinking about like the language that we use when we talk about drugs, and just basically trying to find out what are the public's opinions of drugs and people who use drugs, because you get such a wide variety of views, and kind of the way that people talk about people who use drugs can be incredibly stigmatizing. But
then if you've got the double stigma sandwich of drugs and mental health,
when
absolutely. You put them together, for some that will be, oh no, that's too much to think about. There's too much to understand what's going on there. But actually, the research that you're doing and the data that you're looking at can point us in a million and one different directions that can probably be positive directions if we choose to go down that path.
Potentially, I think so. And one of the things I'm really interested in understanding is in what direction is causality going, because we see the links between drug use and mental health. But is it that recreational drugs increase your risk of poor mental health, or is it the other way around, that people with poor mental health use recreational drugs to kind of help them to deal with what's going on? And potentially it's in both directions. And in some cases, I made these podcasts, and I'm also currently writing Say Why to Drugs, the book. And one of the things that I found when I've been researching is that loads of the drugs that we think of as kind of drugs of abuse or recreational drugs started off medicinally. Certainly lots of them did, not all of them, obviously. And what's really interesting is that that's kind of coming full circle now. And there's lots of research happening at the moment looking at some of these drugs that we think of as, they're dangerous, they're addictive, they can lead to all sorts of problems, actually potentially have medical uses that are being sort of investigated as they were back in maybe the 60s, but under kind of the types of more rigorous experimental designs that we have now and that kind of thing. And I think that's really interesting, that these substances are more than just one thing. They can have multiple uses, some of which can be incredibly maladaptive and some of which can potentially be really useful.
Cannabis presumably is the one you get a lot of phone calls about, because there was, I think it was 2 years ago, there was a study that came out so many calls, particularly within the media. You see different things about variations of cannabis. People talk about cannabis oil and all these different types of things. And there's been some high profile cases where certain types of legalization have been talked about as well. But at the same time, you kind of get a sense that there are politicians who look at cannabis with a capital C and still have this thing of going, oh no, we can't look at that. Whereas I almost think if you just gave everything a different name, if you just changed changed nicotine and alcohol and kind of just changed all the names and then went, right, let's go purely on the evidence, we'd have a very different system, wouldn't we?
Yeah, well, though regarding cannabis, the evidence is surprisingly limited, certainly given its use medicinally in other countries around the world now. It's actually based on surprisingly little evidence, and that's partly because it's been so difficult to conduct the research because of its illicit nature. And I think that if even half of the things that people say cannabis can do is true, then it could be fantastic. But we really need to do the studies to try and find that out and test it the way that we test other medications.
But if you wanted to do a study on the effects of ecstasy or amphetamines and you went to an organisation or the government and said, can we do this? Would there be a reaction from them which was, no, we can't give you a load of amphetamines. Or, we can't give you a load of that.
Well, so there are researchers in this country who have licenses from the Home Office to conduct that kind of research, and they do have locked cabinets in there somewhere, I don't know, where they've got their whatever drugs that they're using to run experiments. But it's really hard to get those licenses, and that's why so few people have them. So it's possible to do that work, but from speaking to researchers who are involved who do have those licenses, it's a headache. It's hard to get funding, although I do think that's changing and people are becoming more receptive to the idea that substances can have more than one kind of use.
Yeah, and you would think as well, because of the international nature of sort of drugs, that anyone who any nation that took the lead could then export that and the skill set that would come with that right across the globe. And that will be a positive thing that a nation potentially one about to leave a major market might want to do.
Potentially, yes.
That might be a benefit or not. We've not left yet. Dr. Suzi, thank you for your time. So the Say Why to Drugs podcast is available to download now. Various different episodes. They're absolutely free. And the book is out start next year?
Yes, that's right.
And that's going to be called Say Why to Drugs.
Yeah, you can already pre-order it on Amazon if you go and have a look for Say Why to Drugs or search my name.
Excellent. And you're up on social media. If you type in Dr. Suzi with an I Gage, you come up as Sousaphone.
That's right.
And that's on @radio in fact, what I'll put that up on @Radio City Talk. That's on Twitter. And Cosmic Shambles as well has got a rundown of your new co-authored report as well. Remind us again what you're working on at the moment. Outside of the book. Lots
of different things. I'm doing a project looking at e-cigarettes. I'm doing another project looking at drug use and stigma. And I've just got a fellowship from the Wellcome Trust to do more public engagement stuff. So I'm kind of trying to think of something really exciting to do with that at the moment.
Excellent stuff. Well, do keep us posted, and thank you for joining us on the programme today.
Thanks for having me.
Dr. Suzi Gage from the University of Liverpool, our guest today on Mental Health Monday.
Mental Health Monday with Mick Coyle.
Radio City Talk.